guys, so a slightly different video from me today from my usual medical content. But if you're new here, I am Brooke. I'm an OBGYN doctor, so that means that I work as a doctor in the UK in an NHS hospital, working on a labour ward, delivering babies, looking after people who are pregnant, looking after people who are trying to get pregnant or other different gynecological problems. And I am also pregnant with my third baby, and I thought that it might be nice to give you a little bit of a kind of chat about what it's like for me being an OBGYN doctor for the third time going through pregnancy and birth myself, and also kind of navigating birth when you deal with, I guess, what is the more kind of complicated, sometimes life-threatening sides of labour, delivery, postpartum, and kind of how you navigate those issues, and also how I've been feeling in my own pregnancy. I thought I'd also explain my other two births that I've had so far, and what I'm expecting or hoping for this time round. So today I am on a day where I'm not working, so I've also been prepping some of the stuff for baby, which is slightly easier when it's your third time because I've got a lot of the stuff. But I thought I'd show you what I'm packed in my labour bag. I've got a kind of checklist that I've used for the last two times, which I'll add to the links in below this video, but I'll also show you how I've packed my labour bag as someone who sees lots of people in labour, and I kind of know the things that you do use, but also maybe some of the things you aren't going to use. I work in this quite a fast-paced, intense job, so we're very fortunate, I guess, now in the sense that OBGYN work in the UK is quite regulated in terms of how many hours we work in a week. But when we're at work, it is very, very intense, very busy. There's very rarely a chance for like a lunch break or anything from the minute I kind of turn up to work, which is usually about 7:30 in the morning, till the end of the day. It's really non-stop and often on your feet, obviously. But basically within about 2 weeks of having that test, I was suffering really, really badly with morning sickness. So I started basically being sick once a day, and then it quite quickly ramped up, and I was doing a job which actually involved quite a lot of clinical contact, which basically means that you're sitting one-on-one with a patient, and I'm sitting there like, okay, how am I going to get through asking all the questions I need to ask that person without running out of the room to be sick? And I was trying to time it so that I was sick between my consultations, and there was one or two times when I was just like, you know what, this is not good for anyone, because I can't concentrate on what that person's telling me and give them the best care that I can give, because I am feeling so sick, and I kind of had to go home in the middle of the day, which is very, very unlike me. And I didn't have this weirdly with any of my other pregnancies. I was nauseous, maybe sick the odd time, but this has definitely been my worst by far, and you just realise how debilitating it is. And so I have got a separate video on managing nausea and vomiting in pregnancy, so I definitely recommend you check that out if you've been suffering as well. And you know, some of that is first-hand experience that I shared there, but also my top tip is always to tell the people around you, because it was horrific, especially at the start. You know, until I was about 6 weeks, I had an early scan because I just didn't know what was going on, whether it could be twins or anything else. Until at that point, I really didn't want to tell anybody at all. I did tell a lot of the people that I worked with, you know, this is how I'm feeling, this is why I look green, this is why I'm going to be running out of the room. I did some labour ward shifts during that time, I had some night shifts, and actually it was really, really difficult managing, you know, helping to deliver somebody's baby or being in a cesarean with a mask on when you're feeling really nauseous. And I never wanted my patients to feel that I wasn't, you know, 100% focused on them and giving them the best care. And that's where doing this kind of physical, practical job is really challenging when you're not feeling 100%. But equally, you know, there's no one else to be the obstetric registrar on call in the middle of the night. Who are you going to call to come in and cover for you so you can go home or you can lie down? It's a really difficult balance, because you don't want to let anyone down. You also don't want to leave the patients without cover. And so, yeah, I think it got to a certain point when I could see that this wasn't going to let up for at least a few weeks. So I had to, again, speak to the people around me, speak to the people that manage the rota, and just say it's better for you to be able to plan to cover my shifts in advance than to try to cover them, you know, and me to try to make it through and not be able to. So I did stop night shifts actually pretty early with this pregnancy, around kind of 11, 12 weeks, because I just felt I wasn't able to contribute to the team properly and do my best, and it was really difficult to adjust back over. Anyway, made it through the first trimester, and thankfully that did pass. And so then the rest of it has been, thankfully, touch wood, all right. My pregnancies have been fine in the past. I find it uncomfortable, but other than that, you know, I don't have some of the other medical issues that we do come across. And so I've just been getting on with my normal job, and I guess that's where the psychological side of working in this field becomes difficult. An important part of this job as well is often looking after people who sadly lose their babies during pregnancy, either go through miscarriage or go through stillbirth and things like that. And it's very difficult when you know when you're pregnant yourself, first of all, how that will be making that other person feel when they have lost their baby, and the person that comes to talk to them or tell them about it or manage the next steps is heavily pregnant themselves. It's difficult on both sides, of course, much harder for the person that's going through it. And so that side of things is sometimes difficult, and sometimes if there's another option for somebody else to go and help that person, I would choose that, not because I don't want to be the person that offers that care, but just because I just don't want to be anything that adds to that that experience for them of sadness, and it obviously makes me reflect on my own pregnancy, how lucky I am, how fortunate I am, but also that things can change in a minute. And maybe that's the kind of another downside of the job, is that you do see what can happen, and I never ever take anything for granted. I never assume we're going to bring home a healthy baby, because I've seen things go wrong at every stage, and that gives you anxiety, and it makes it difficult to kind of relax in this process. Maybe I'm more pragmatic about it. We still have a name for the baby. As I say, I hadn't packed the bag. It's not that I think something's definitely going to go wrong, but I just know that it can at any point, and it won't be because of me. It won't be because of something I've done. It's just the nature of, sadly, how this process works, and so much needs to line up for you to be able to bring home a healthy baby at the end of it. So I just don't take it for granted. Some of the things do hit harder when you're pregnant yourself and you see some really traumatic births or really difficult, journeys and deliveries. But that's part of the job. And also, now I've been doing this job for 9 years. I guess I know that whether I'm pregnant or not, I know about all those things that can happen. So I have the fortune also of knowing that the vast majority of the time things are okay. And I guess that brings me on to what has happened to me before, what my births I've had before, which really, actually, as an OBGYN, as an OBGYN doctor, shocked me, because I never expected to have a normal delivery. Especially my first time round, I was prepped. In my head, I was going to have a complicated induction of labour. It was going to result in, some crash cesarean section, and that was going to be my journey, because that's what I see, and that's what, as doctors, we are used to managing on a labour ward where things go wrong. Midwives in the UK are who deal with kind of normal, typical birth where everything starts spontaneously and goes to plan, and doctors get involved when things don't. So I really did not expect that with my first birth that everything would actually go really quickly, and I ended up having a vaginal birth, and I had, I guess, what most people would consider a really good experience. I didn't love the experience, I would say, but it was a good kind of experience in recovery. The short story, I've given the whole long story before, but the short story of my first birth was that I was I had sweeps. So I had sweep at about 39 weeks and had another sweep about a week later, because I was desperate to try and get the baby out. And about 6 hours after my second sweep, I started to have some contractions. They were on off. So after I waited maybe about 12 hours, I felt they were building up. They were coming every sort of 2 to 3 minutes for a couple of hours. I was it was 4 a.m, got my husband up. I was let's go to the hospital. I think the baby's coming. And got there. I was only 2 centimetres, and I was sent back home. And it's so funny because, I never thought that would happen to me as an OBGYN doctor, that I would know when I'm ready to deliver, but actually I wasn't. My first baby, it was slow, got sent home, basically waited another 6-8 hours, walked all the hills, up, down, everything that I could think of to do. Felt like it was getting more intense. I'd been having now contractions every 2 to 3 minutes for 24 hours, went back into the hospital, again, still 2 centimetres. They've told me you can stay if you want, but really why? So I went back home again. I went back home, waited again. I was getting frustrated, had a bath, tried to get some sleep, was still having contractions every few minutes. Sometimes they spaced out a bit more, sometimes they got back closer together. And eventually I was just I'm exhausted, I'm in pain, I need something. Went back in for the third time, still 2 centimetres. By this point it was over 24 hours, coming up to 36 hours I think. Had some pethidine in the triage just to give me some pain relief, because it just seemed like it wasn't coming anytime soon. Went to the ward for about 2 hours, where I just because they'd given me the injection, they didn't want me to go straight home. And suddenly everything ramped up much more intense. So I thought what I was having was quite intense contractions. It wasn't. It suddenly became really, really intense. I got the midwife to check me. She was like, yep, you're now 3 centimeters. So I was like, give me the epidural. I need to get on with things. I need this to happen. So we walked over to the labour ward. Everything changed. I had this unbearable feeling like I needed to push. And given that I was 3 centimeters, everything had been really slow. I was in no way expecting that the baby could be coming, but I didn't understand what my body was doing. It was something that I hadn't imagined or thought about before as an OBGYN doctor. And suddenly my body's like trying to push, and all my muscles are tensing down every time I have a contraction, and I couldn't control it. We made it to the room, and they were like, we think things are ramping up and you probably won't have time for an epidural. And I was like, no way. This is what I want. I want an epidural. I need an epidural. Get me the anaesthetist now. And basically, by the time they came in, I was pushing without wanting to. So this term, like involuntary pushing, which I'd kind of heard of or seen people do, and I was like, stop pushing. Come on, what are you doing? You're not ready to deliver. I'd never imagined what that feeling would feel like, and it's actually a horrible feeling because you want to try and control your body. I wanted to try and stop it from pushing because as far as I knew, I was like 3-4 centimeters dilated. I was not ready to have a baby, but my body was doing it. And what it turned out was I was fully dilated. I'd gone from 3 centimeters to fully dilated in about half an hour, mainly I think because I walked, so that extra gravity of walking from the ward to the labour ward. But the baby came very quickly with a couple of pushes that I really wasn't able to control or wasn't aware of. So in a way, I had a very long build up to my first labour of kind of like 2 days basically of on-off contractions, but the actual active labour was very quick. So I had a vaginal delivery. I had a good experience in terms of the recovery. I was back on my feet and I went home within about 6 hours. Again, on one hand, sounds great, but it's not something I would do again, and is not something I really recommend to people. I mean, it's something that we offer in the UK. If you've had a good delivery, no complications in your pregnancy, you don't have to stay in hospital. You can go home after 6 hours if baby's okay as well. But actually what it meant for me was I had no support with breastfeeding. I thought I knew what I was doing. I did not. I really, really, really struggled with breastfeeding, especially first time round. And although the midwives, don't have loads of time to offer you support, at least you can call them. There's someone to call to come if you need some help. And I never, nobody ever watched me do a breastfeed. I just thought I was putting this baby on. It turns out I was latching completely wrong, and it became really painful, and it tore up my nipples and everything else. Yeah, I kind of regretted leaving hospital very quickly, although I was back at home in my own environment. So that kind of experience taught me some things. And then when just under 2 years later, I had my second, quite a different experience again. At the time, I was working right up to the end. I decided not to take any maternity leave before. My last day of work, had a sweep as I was at the labour ward, and I was about 38 and a half weeks, which again worked for me. So sweeps have been successful for me. I started having contractions within a few hours after that sweep. Managed to get back home because I was at the hospital. I was going to give birth out just because I was working there. Managed to get back home, let the contractions build up for about another 6 hours or so. Felt it was getting very intense, and I was keen that this time, because I didn't get an epidural before, that I really wanted an epidural. So I wanted to go in there earlier, expecting second baby. Maybe it's going to come quicker. Maybe, there won't be such a long build up. And I went in, and actually this time I was 4 centimeters. So I was in active labour. They didn't send me home because usually up to about 4 centimetres, 3-4 centimetres is considered the latent phase when things are quite unpredictable and slow. And after that, it tends to get more predictable. We usually advise people maybe to stay in hospital if that's where they want to give birth. So I stayed in, I got my epidural put in, and actually I had about 6 hours of contracting, but I didn't really feel it. I was able to relax. I had an epidural, got to kind of I stood up at one point to try to go to the loo, and then my waters broke at 9, and I was 9 centimetres by that point, and baby came okay, like relatively fine. Not a very long pushing phase, again, a spontaneous vaginal delivery. That time I stayed in overnight and had a kind of better recovery. I was keen to stay in overnight because I also had a nearly 2-year-old at home, and I just wanted a bit of time to bond with my baby, to have some time with just me and my husband and the new baby before we got back home to the kind of craziness of everything else. So yeah, in terms of as obstetricians go especially, I had good experiences. I'm very lucky. I don't, again, take for granted that that's the experience I have this time. Every baby, every birth is completely different. Of course, I'm planning for hopefully a spontaneous vaginal birth. I'd also like it to be a little bit early. I'd like it to be before the due date ideally. And we know that anything from 37 weeks is considered term. So I'm 33 weeks now. So I'm thinking, you know, in the next 4, 5, 6 weeks, maybe this baby's going to arrive. But I might go past my due dates this time. I might have a cesarean section. Things might happen. Complications might develop. I might develop an infection. I don't take that for granted. So I kind of prepare in my mind for all eventualities. But anyway, that is kind of where I'm up to now. In terms of preparing for birth, I said I packed my labour bag. I'm trying to stay active. Now, the biggest problem I've got right now in my 3rd trimester is really, really, really bad pelvic pain. Again, not the worst problem to have, but it's very difficult when you're trying to be active, you're trying to work, you're trying to look after 2 kids, a house, etc. That I basically struggle to walk at all because of pain in my sacroiliac joint on the right side. I've had it with all 3 pregnancies. I haven't had physiotherapy this pregnancy just because I kind of forgot to prioritise myself. Essentially, that was it. I've just not had time for appointments, and what I should have done is got physiotherapy, knowing that this would probably be an issue for me. So I've started wearing a belt, and I've got a physio appointment next week. I'm hoping it's probably a bit too late. I think I just had to wait it out. I have got a video that I did with Claire Bourne, who's a physiotherapist, about pelvic pain in pregnancy. So I'm also going to be starting to do some of those exercises and if you've got a similar issue, check out that because it's got some stretches and exercises that you can try and do specifically for this. And another thing that I'm thinking I might try and get before baby comes is some acupuncture as well. Again, to try to help with this pain. So I'm just still trying to stay active despite all of that. So I've got a Peloton and doing some yoga stretches and things like that, but nothing that I can do that's too strenuous on this pain. I have packed the bag. I'll be starting perineal massage from 35 weeks, which is what I did with the other 2, and I didn't have any tears. Again, very lucky, but hoping to keep that pattern going. I've got a video on perineal massage as well, if you want to check that out. And that's pretty much it. I'm planning to work right up until the end. That I've told work that I'm taking for maternity leave, I'm like 39 and a half weeks. But if baby comes before, baby comes before, because I don't really want lots of time of waiting at home. I want to use my maternity leave after baby comes. I'll show you what I've put in my labour bag for now. I'm on the floor of what used to be our office, which we've cleared out. It's just kind of like the box room upstairs, which is where I'm keeping all the baby stuff. It's basically every baby item that we own. It's just chucked into the room. I don't have any furniture up here, partly because I haven't got around to it, and partly because I know that the baby's going to be with us in our room for the next 4 to 6 months. I just need somewhere to kind of store the clothes, maybe change baby, etc. I will figure out this room at some point over time. And I think it's funny because, I don't know, when you have your first baby, most people are like obsessed with decorating the nursery, etc. And actually, when I had my first, we were in a 1-bedroom apartment, so I never had a bedroom for her. I kind of felt like a bit of a failure as a parent because I didn't have this perfect nursery to furnish and buy all the animal prints to put over the cot or whatever. And obviously it was fine. By the time I had my second, we were in a 2-bedroom apartment. So again, I didn't have a dedicated room for the baby. I didn't really buy a lot of that kind of nursery furniture because I knew we were just going to add in a cot into the room that we already had. So again, didn't design a nursery. And this time I've got the space, but the kids are really happy in their rooms. I don't want to move them from where they are, and those are the rooms that are next to my bedroom, and it just doesn't, I don't know, it doesn't matter. I obviously care much more about making sure that the baby is healthy, that we've got the stuff that we need to kind of keep the baby alive over the first few months, and whatever we do with the space we'll kind of figure out. It'd be lovely to have this as a nicely designed room because I do love designing rooms in the house, but maybe when I have less work on and I'm on maternity leave, not that that's gonna have loads of time, but I will have the time to kind of think about this space maybe a little bit more. But anyway, for now, what we have got is essentially just like a changing table, which I might move down to my bedroom, and the bedside cot, which again will go into my bedroom, and then just some boxes filled with clothes, blankets, etc. Anyway, I'm up here because I am just putting in the final bits to the bag for the hospital bag, and I thought I'd show you how I do it. So my main top tip for anybody that's packing a bag for labour is to think about who is going to be using the bag. Now, unlike any other bag that you pack for, say when you're going on a trip, a holiday, whatever, you're packing the bag, you're the person that's going to be using it. Remember that usually, especially if you're bringing someone with you to your labour, if you're going to be in pain, if you're going to be the person having a C-section or whatever, it's unlikely that if you need something from the bag that you're going to be the one that's going to get up and go rifle through it. Usually that's your birth partner, your partner, whoever's with you. So it's quite useful to really signpost what you might need. So I usually actually packed previously into plastic bags. This time I've upgraded and just ordered a set of packing cubes from Amazon that are kind of see-through. It's really easy to find what you need. So for example, my first one here is essentially just a bag that's got the first outfit, and I've labeled it, although my labels aren't staying on very well, but essentially these cubes, each one has like a label on it and it's see-through. So in that first outfit, I've essentially just got a nappy, a vest, a baby grow, a muslin, and a hat. That's it. So that if we go for a C-section, or if, you know, baby's coming, then and the midwife says, you know, I need the baby's first outfit, that's all that my husband needs to grab, just that. So that's got to go in the bag, and then basically the rest of the bag is packed similarly. So I will just grab you and show you. So here we have it. So it's just like a normal suitcase divided in two, and one side, this side over here, is just filled with stuff for me. So there's a bag of things that I might want for during labour, like an eye mask. It's got a fan in there and some other things, some clothes, remembering that the clothes are just comfy clothes. I haven't put any jeans in there or anything like that. They're basically tracksuits and things like that. Some toiletries, again, doubles, because there's no point in putting in things that when I'm in labour, I'm going to need to suddenly run around the house grabbing my best shampoo or whatever to take with me. It's just extras that I've got, or little miniatures or whatever, there's travel size stuff. Just so this bag is now, like, as of today, it's just going to be packed up and left. And if anything happens over the next few weeks, I have bleeding, my waters break, whatever, we just have to grab the bag. Even if we don't end up staying in, we come back home, it's just there ready all the time. So I'm just going to fit all of that together, and then it's just the one bag that we need. In terms of like things that I've bought this time, I really haven't bought any new stuff. All of my like baby grows and things like that are from what I had from the kids. I've had one girl and one boy, but all my newborn stuff is neutral. I've just got loads of white baby grows, vests, muslins. I also really recommend things like Vinted, buying things secondhand, borrowing from friends. It's amazing how quickly you get through a lot of the newborn clothes. Like, I am pretty much expecting to go quite quickly into the 0 to 3 month clothes, so I don't have a lot of newborn sizes. I'm not fully ready. There's not a beautiful, perfect planned nursery, but otherwise, if baby comes earlier or anything unexpected happens, I feel like now at least I'm ready for that. Hope this video was of interest. Please do leave a comment below if you'd like me to share anything else about the pregnancy journey in a vlog.